Hi, I'm Robin. I'm a myofunctional therapist and dental hygienist, and I talk about all things oral health. Today I'm talking about airway problems in children. When we talk about airway problems, we're talking about any sort of issue a child might have with breathing properly, whether that's nighttime or during the daytime. It can affect oxygen levels, their sleep quality, growth and development, and even their behavior. Concerns are often overlooked because the signs can be very subtle. So the things to watch out for during nighttime that could indicate an airway problem are snoring, even if it seems mild or intermittent, mouth breathing during sleep, restless or frequent movement during sleep, grinding teeth. Children could have night sweats or waking up very tired in the morning or being difficult to wake up. Sleep is when the child's brain and body reset and they should be fully recharging. So poor breathing can really interrupt that process. The signs and symptoms to look for during the daytime that you may notice that could be attributed to airway problems include chronic mouth breathing, dark circles under the eyes, also known as venous pooling. Sometimes people refer to those as allergic shiners. Difficulty focusing, hyperactivity, especially in the school setting, fatigue even after they have a full night's sleep. They could be irritable or have mood changes, and speech and swallowing difficulties as well. Things that you may notice on the oral healthcare side, or some things that we can see clinically, are a high arched palate. We might see lips that don't fully close comfortably without extra muscles to help compensate for that. Crowded teeth. Again, we look for that venous pooling under the eyes. We can see that the growth and development is affected by seeing that that chin is recessed or underdeveloped. We're also watching for an open mouth posture or tongue that's resting in a low position and not suctioned up to the roof of the mouth properly. These features can be related to how the child breathes as well as how their airway is developing. Early intervention is very key because we can support healthy growth and facial development by applying some simple and preventive measures early on. We can improve the quality of sleep. It enhances their focus, behavior, and energy, and we can reduce the need for more invasive treatments later. Sleep disordered breathing in children often results in obstructive sleep apnea in adults. Early intervention is about guiding the growth, not waiting for problems to get worse. What do parents do if you notice these signs and symptoms? The best thing to do is consult with an airway focused dentist or orthodontist and see if you can get some answers and guidance on what you can do. Different age groups of children require different interventions, and so you can meet with someone who has some expertise in that field and can meet that child's needs specifically. Oftentimes, treatment for airway problems involves a team approach. It's very multifactorial, so we need to make sure that allergies aren't a problem. You may see an allergist to see if there's some congestion problems causing the child to be a mouth breather. You would maybe consult an ENT to make sure adenoids and tonsils aren't the problem. During the course of treatment, we often recommend some body work to try to help relieve tension and help the child relax as well, and sometimes some expansion of the jaws to help that growth and development is indicated. So if you notice any of these problems in your kiddo, maybe do some deeper digging and see if you can find an airway provider to try to evaluate your child. If you have any more questions, let me know.